through the meridian, where does it go on the body?
I love this part. I mean, the snake that swallowed the gopher is a meridian system. The gopher is the organ. So the stomach, the bulk of any meridian is the organ proper itself, which most people think the meridian are the tails, but the bulk of any meridian is the organ itself. I got excited when you said, the location, because that's when I just, as a shiatsu practitioner, so tantalizes me that it starts here. It doesn't start here. You would think it starts here, but it doesn't. It starts at stomach 1 at the eye. And you may remember from my shiatsu course, why does the stomach channel start at the eye? You don't put hot food in your eye. Well, maybe because we stomach sights. So that's why the stomach goes to the eye. We not only stomach food, but we stomach sounds, emotions, thought forms, images. We stomach all of these things. So stomach wellness, from a holistic practitioner perspective, includes not just digestive function of food, but digestive function of thoughts, words, and images. So the stomach channel starts mid-pupil line, right at the bottom of the orbit. And then goes to the corner of the mouth to the abacularis oris. Is that what that's called? The muscle around the lips. This meridian, each of the meridians dominate different tissue. The lungs dominate the skin. The liver dominates the connective tissue. The stomach, spleen, earth dominates muscle. So this meridian is going to be muscular the whole way through. So that's why the abacularis oris, it goes right through the muscle around the mouth. And then goes down through masseter, because we need to have that stomach to grind the food. And it goes right through the middle of SCM. Now that's on the line chart. In my belief, that's where the line is, but if you push on the middle of the SM, it touches the esophagus. If you go to the trough next to the trachea and push, it hooks on the trachea. So that's why the lung meridian is in the trough. The stomach meridian's on the SCM. Because from there, if you go perpendicular, you touch the esophagus, and the esophagus is the extension of the stomach. Yep. The mouth is the opening to the stomach. The esophagus is the extension of the stomach. So from here, it goes through SCM to mid-clavicle, through, guess what? Mid-breast, mid-nipple, for that whole mama's milk, young, mean, great brightness, stomach meridian giving nourishment. And then from there, it cuts back into the middle of the six-pack through rectus abdominis, that big muscular over the belly, to the pubic tubercle, and then it goes over to the high point of vastus lateralis, through anterior tibialis, through the center of the dorsum of the foot to the lateral portion of the second toe. So it's a long channel that's super muscular. If you're not on a muscle, you're not on the channel. Okay, so that's the location of it.
That's cool. That's super cool. Because even the esophagus itself is a big muscle. I mean, as it moves the food
peristalsis.
Down. Peristalsis. I mean, if anything, I don't know if the stomach layer itself, I think it has muscle. I don't know.
Of course. That's how it churns. Have you dissected the stomach?
Oh.
Yeah, there's a thin muscle layer through it. There's a couple of layers, but the thin muscle layer in the middle of it.
Yeah, cool. I love the idea of the stomach of the imaging, stomach of the emotions. I mean, having been on the table with you and you're like, don't stomach that. I'm like, what the heck are you talking about? Yeah. also usually followed by
There's a slight chance there when they stomach it. If you can block it before they can't swallow it, then I'm like, spit it out. And I mean, it's okay. If they get past it, that's fine. I'll just go down to the stomach and fuka. Within a person's tolerance, I won't go all that with everything.
People are like, I never want to have a session with TJ. No.
There's a portion of my clientele that like, it's just too much, man. There's some other way, and that's fine. And I can tone it down to all the way to off the body work where you don't even touch them. Because one of my teachers, the whole lineage, quantum shiatsu, is an off the body work. So it could go anywhere from off the body to full trench work.
Talk me through the breast and the swelling of the mother's breasts and that kind of. How does stomach play out during gestation?
It's beautiful. It's one of the most beautiful things to observe ever. The whole channel. Have you ever seen a mother face where their face broadens and widens? It's because that meridian, yang ming. You know, the meridians, as we talk about it with these Western terms, that's not their real names. The Chinese had their own names before they got labeled with Western terms. And the Chinese names have a lot more meaning. So this meridian's the leg yang ming in Chinese, the meridian of great brightness. Brightness being the yang, great brightness. It's the biggest yang channel. And when a woman gets pregnant, this meridian of great brightness swells, and their face swells, and their tissues broaden, the breasts swell, the belly swells, the whole channel just gets so beefed up with earth energy that's being pumped into the child and preparing to nourish the child with breast milk when it's after delivery. So it's quite simple, and it's beautiful to watch that meridian get wider and the facial structure changes.
It's super cool, yeah. And then the delivery of the milk afterwards, that connection, as you said, the connection of the mouth to the nipple, bringing in that original. Very good.
I have a theory that's why beer bottles are shaped the way they are, to make a nipple. And then you get the burr, just like a baby does, and then you get the drowsy, just like a baby does. Like the beer bottle somehow plays off of this whole yang ming brightness nourishment for the mother. Unfortunately, it doesn't work, and it leads towards a whole plethora of problems. But I do think that's why beer bottles are shaped the way they're shaped.
Probably unconsciously, but maybe not.
Societally unconscious.
Yeah. A couple of the big points. Do you want to just? I know there's a couple of big points on this channel. So, what do you got?
Let's go into pathology before we go into treatment.
All right. So.